Hello, my name is Dr. Richard Harris, and I am an internal medicine physician and pharmacist and the CEO of Great Health and Wellness here in Houston, Texas. And today we're going to be talking about CBD. Specifically, is CBD safe? This is something I get all the time from people. And what do I tell them when they ask this question? I say, yes, but it matters where you get your CBD from. So high quality CBD is completely safe. I take CBD for myself. I put family members on CBD, and a lot of my clients and people I work with, I recommend CBD for. Now, CBD is safe when you're getting it from a source that is reputable. A source that is FDA inspected, that is NSF, CGMP. These are all monikers that let you know what you're getting in the product has been tested. Also, the high quality CBDs will put the certificate of analysis front and center on the website. And not only will they let you know what CBD is in there, as it other cannabinoids are in there. Some of them will even put in what terpene profiles are there. But they'll also put heavy metals and other contaminants that are tested for. And so that is the highest quality. That way you know you're not getting products that are contaminated with pesticides and heavy metals. So CBD by itself, if you just look at the molecule outside of how it's made and how it's prepared, its safety profile, it has a great safety profile. When people take CBD, the only side effects that they may experience are some GI symptoms, nausea, some stomach upset, maybe diarrhea, but it's a very low percentage of the population that actually gets this. I actually have put a lot of people with bowel conditions, irritable bowel, inflammatory bowel, those kind of things on CBD because of its anti-inflammatory properties. Now, the only other thing you have to be concerned about from a safety perspective when it comes to CBD is, does the CBD interact with medications? And so this is a little bit more of a concern because unfortunately a lot of people out there are on a lot of meds. The average 65-year-old is on 12 to 16 meds these days. So a lot of people are on medications, and so CBD can interact with our medications, and it can do so in two different ways. So low dose CBD, kind of what you see when we're using it for sleep or anxiety or pain, somewhere around that 20 to 40 milligram mark is where a lot of people live comfortably. Low dose CBD can actually inhibit enzymes. So this can inhibit some of the cytochrome P450s. This is the system that degrades our drugs. CBD particularly interacts with 3A4, which is the major cytochrome for degrading drugs. And so you can get increased levels of certain drugs with low levels of CBD. So this is something that you have to be aware of when you're starting CBD. And that's why I always recommend go low and start slow. So you start at a low dose and you increase slowly by 1 or 2 milligrams a week till you get to your desired effect. Now, some of the clinical trials with CBD for things like fibromyalgia and seizures use really high doses of CBD, 300 milligrams, 600 milligrams in that range. And it was well tolerated. It was still safe and well tolerated in those dosing ranges. But when you have CBD at that high of level, what happens is CBD actually induces its own metabolism. So before, in low doses where you have it inhibiting enzymes, in high doses it actually speeds up those enzymes. So high dose CBD now, instead of having more of the drugs around, now you have less, and so that can lead to treatment failures. And so that's something that you'll have to be aware of if you're using high dose protocols. And those high dose protocols are seen for things like neuroprotection, for certain inflammatory disorders like MS, or also if you're using it for severe pain, cancer, or seizure protection. Those are some of the things that you'll see high dose CBD used for. So let's wrap this up with a quick recap. Is CBD safe? Absolutely. Get your CBD from a reputable source, something that is CGMP, FDA inspected, US grown, and has the certificate of analysis clearly displayed. That's how you know you're getting a high quality product. Do not get your CBD from a smoke shop. Okay. That's where you can run into issues with adulterated product or product contaminated with heavy metals. Some side effects of CBD, usually very, very well tolerated, usually GI upset, nausea, vomiting, diarrhea. If there are going to be any side effects, and usually that goes away, but we do use it for bowel conditions to help people who have those issues going on. And then the last thing you want to be concerned about when you're using CBD is medication interactions. And that's why we say start low, go slow. I'm Dr. Richard Harris. Thank you for listening. And I hope you found this informative, learned something about CBD, and feel comfortable recommending it to people. As I've said, it's something that I've been using for years now, and it's something that I highly recommend. Thank you.
To learn more, visit our Learning Center at www.cbdhealthcollection.com.